I was very uncomfortable while going up to my house because we are in first floor. So I went to check this. Then we came to RV.
They said one of his wall has become small. That's why he is feeling breathlessness. So some aortic stenosis.
So aortic stenosis is a condition where the aortic valve is narrowed to very critical extent that it prevents the easy blood flow exit from the heart. Aortic stenosis happens because of calcium deposition in the valve, which happens because of increasing age, and as you can see here, when the blood flow exit from the heart is less, it can cause chest pain while patient walks, or when somebody is running out of breath even for short distances. Some people can even lose consciousness. So aortic valve, once it is critically stenosed, needs to be replaced. So what is generally done is a artificial tissue valve is placed in the position of a deceased aortic valve. So conventionally this procedure is done by an open heart surgery. However, now this can be performed through a small incision in the groin of the patient, where a valve is placed through a procedure called as TAVR.
See, when I met Dr. Venkatesh, he explained me completely, thoroughly what is to be done and what is wrong with my heart. And he said there is a procedure called TAVR procedure, and through which your problem can be sorted out.
TAVR is transcatheter aortic valve replacement. Some people also call it as TAVI, where it is transcatheter aortic valve implantation. An artificial valve is made into a small thin tube, and through an incision in the artery in the leg, this valve is taken up into the heart where the deceased valve exists, and there this valve is released in a way that it opens up and functions like a normal valve. TAVI has been tried on various populations. So TAVI is typically reserved for patients who are unfit to undergo open heart surgery for various reasons. Our patient is 74-year-old. He has had a bypass surgery in the past. So therefore, the grafts to the old coronary arteries will come in the way of our open heart surgery if we do it again. When such a patient comes to us, what we generally do is, there is a heart team concept. The heart team consists of a cardiac surgeon, a cardiologist and a cardiac anesthetist. This team sits together and assesses this patient and sees whether this patient is fit for an open heart surgery or whether the patient should be a candidate for TAVR.
So in this patient with the patent grafts, doing a redo sternotomy and doing a valve replacement on a dialysis patient is very, very risky. That is when we thought of TAVI in this given patient.
So then I spoke to Dr. Divakar Bhat, said, we'll do it. Be confident, he said.
Usually, as I explained, the TAVI valve is implanted from the artery in the groin. Unfortunately for this patient, who has been a long-standing kidney disease patient, the arteries of both the thighs, both the legs, and also the aorta, which is there in the lower part of the abdomen, were all highly calcified. They had become rock hard and also had become very narrow. The narrowing of these arteries was so much that we were not able to pass the TAVI valve through that. Some of these cases, we do pass these TAVI valves through the arteries of the hand. This patient had a previous bypass surgery, so one of his grafts to the heart actually comes from artery of the left hand, and he has a dialysis catheter on the right side of the chest. So because of that, the arteries of the hand were also ruled out as the access for putting the TAVI valve. So finally we had no other option but to consider inserting this valve through an artery in the neck. And this is unusual. This transcarotid transcatheter aortic valve implantation is a rarely performed procedure, and this was a very challenging case for us.
Carotid arteries, so far majority people have not done, so it is sort of an uncharted territory for us. So whenever we are, see, there are 4 vessels which gives blood supply to the brain. So in that one we are using for this access, and whenever we are clamping this vessel, there can be a reduction in the blood supply to the brain, and they can have a stroke or major cerebrovascular accidents we see. So for this we had to do a thorough planning by clamping this, whether the other vessels will give us sufficient blood to his brain or not. So for this we did a MR angiogram and cerebral monitoring technique we had discussed with my anesthesiologist. Yeah, there are several machines to do this, bispectral index and cerebral oximetry. We had both in this hospital, and in this case we had followed cerebral oximetry measurement.
The typical instrumentation, whatever equipment that are prepared for a TAVI valve, are designed for insertion through the groin. The tubes are longer and they are straighter. When we are performing a procedure, we are at the operating team is at the head end of the patient, and right there the anesthetist is also standing, and our X-ray tube is just behind. There is about a feet of space between the patient and the X-ray tube. So this specific equipment which is not available for carotid insertion, and the space management was a big challenge for us, but this was meticulously planned beforehand, and because of that this procedure went on very smoothly.
And finally everything went on well. The operation was very success, and my husband is now he's keeping a good health.
The total stay, including the pre-operative 1 day stay, was 4 days, and on the next day of the procedure, the patient was able to walk around, feed by himself, and he was able to take care of himself.